Imagine waking up tomorrow to a world where healthcare is simple, effective, and personal. Sounds like science fiction, right? Well, guess what? Artificial intelligence is turning that fiction into reality. Today, we're diving deep into how AI can actually heal healthcare. No hype, just thrilling breakthroughs, real challenges, and what this means for patients, providers, and everyone in between. If you've ever been overwhelmed by doctor's visits, bills, or endless paperwork, hang tight. This could seriously change the game for you. Think about this. Healthcare's complexity isn't just frustrating for patients, it exhausts doctors, nurses, and entire systems. But for the first time ever, powerful AI can help us finally cut through the noise, untangle processes, and make healthcare about, well, actual healing. And who better to break this all down than Dr. Edmund Jackson? With a PhD from Cambridge and decades wrangling data, algorithms, and healthcare systems, he's leading a movement to actually make healthcare work for us. Yes, the Dr. Jackson behind UnityAI, the guy who runs marathons and practices Tai Chi to stay balanced. Makes sense, right? Let's start with the basics. AI is already working behind the scenes in almost 80% of U.S. healthcare organizations. It predicts wait times, builds personalized medication plans, and helps teams respond faster to emergencies. Pretty cool, but that's just scratching the surface. But here's what nobody's really telling you. It's not just about tech. The real revolution is how AI can humanize healthcare, helping doctors focus on people, not paperwork, and giving patients information, empathy, and power over their care. Still skeptical? Picture this. What if every single treatment you get was tailored exactly for your body, your genes, your needs? That's the power of personalized healthcare. And AI isn't just making it possible, it's starting to make it real. Of course, with great power comes great responsibility. That's why leaders like Dr. Edmund Jackson aren't working alone. Big names from Stanford's Medicine and the Institute for Human-Centered AI have launched the Raise Health Initiative. Their goal? Making sure that AI in healthcare is not only safe and effective, but genuinely fair and transparent. This isn't just headline news, it's a call to action for researchers, doctors, patients, and regulators. How do we make sure our medical data is protected while getting AI's benefits? How can everyone access breakthroughs, not just a privileged few? Let's hear from Dr. Navid Toosi Saidy, an expert in biomedical engineering and digital health. He's translating AI from research labs to real clinic floors, turning futuristic treatments into tomorrow's standard care. Think biodegradable implants, smart devices, and solutions that connect people and doctors in totally new ways. Here's a wild stat. AI algorithms are now predicting patient outcomes more accurately than traditional methods in many cases. That could mean less trial and error, fewer unnecessary treatments, and a smoother path to feeling better. But it's not all smooth sailing. Ethical challenges are huge. How do we know an algorithm's diagnosis is fair, unbiased, and safe? Who watches the AI watchdogs? That's why the Raise Health Initiative is so urgent. Now, if you're sitting there thinking, can AI really fix these problems? You're not alone. That's the conversation innovators like Dr. Jackson and Dr. Saidy want all of us to have. Because the future of healthcare is collaborative, patients, doctors, engineers, and yes, AIs, all working together. Imagine a world where your diagnosis is made earlier, medicines are tailored for you, and paperwork shrinks so doctors actually look you in the eye. That future? It's closer than you might think. And hey, if you're into this kind of cutting-edge future of healthcare talk, consider subscribing. It's the best way to stay ahead of these incredible changes. So what's your biggest hope for AI in healthcare? Is it a cure for paperwork headaches or unlocking medicines we've only dreamed of? Drop your thoughts below. Seriously, your opinion could inspire someone else. To wrap this all up, AI isn't a magic wand, but in hands like Dr. Jackson and Dr. Saidy, it's an engine for empathy, safety, and smarter care for everyone. The only thing more complex than healthcare is, well, us humans. But with the right tech and the right values, maybe we can finally tip the balance, from suffering to healing. Thanks for tuning in. Stay curious and healthier. Until next time.